Today, we want to give special recognition to a few faculty members for their significant diversity and inclusion efforts. The Provost Award for Diversity in the Curriculum is a way to especially call out their efforts, and I am always very pleased to be able to be a part of this celebration and to learn about the innovative things that our faculty colleagues are doing. So, sponsored by the Office of the Provost and the University Center for Teaching and Learning, the awards are intended to recognize faculty whose efforts to strengthen diversity and inclusion in the classroom have resulted in changes of impact. These changes are in areas such as updated curriculum, expanded cultural awareness, development of teaching methods that are especially inclusive and interactive, and consciously created learning environments that are welcoming and inclusive. And now I'm very pleased to announce the faculty winners of the 2020 Provost Award for Diversity in the Curriculum. The first winner is Thomas Akiva from the School of Education. He's being recognized for making equity and anti-racism a central focus in the EDD program's on-ramp course, and subsequently in the entire EDD curriculum.
In 2019, we worked to make equity and anti-racism core to this course. I facilitated workshops, we added related assignments, and we invited several guests to share equity perspectives with our students. This then led to changes in the overall program. Striving for equity and justice is now a guiding principle for the entire EDD program. I'm deeply humbled to receive this award. I've been privileged to collaborate with co-instructors, and we work as a team to strengthen what we offer to our students. And we have an amazing leader, Dean Valerie Kinlock, that supports and challenges our school to center this important work. Thank you.
Congratulations. So the next winner is Dr. Kayla Booth from the School of Computing and Information. She's being recognized for enhancements to the iSchool Inclusion Institute, which is a diversity, equity, and inclusion initiative that prepares students from underrepresented populations for graduate study and careers in information and computing.
I have the pleasure of serving as the PI and director of the iSchool Inclusion Institute, or I3 for short, and we are funded by the Andrew W. Mellon Foundation. We're a national undergraduate research and leadership development program that prepares underrepresented students for careers in graduate study in information and computing. We really work to reimagine the traditional undergraduate research program model from a single summer experience to a 20-month-long equity-centered program that really allows us to build authentic relationships where students can bring their whole selves and where we maintain a close-knit community over many years. It starts in undergrad, but it moves, into a whole lifetime.
Next, I'll introduce Juja Horvath and Christine Wankiri-Hale from the School of Dental Medicine.
Our curricular module deals with culturally insensitive situations in the clinic when the appointment is no longer about dentistry. The idea originated from a student and became a student-driven component of the curriculum.
Including our students' voices in our diversity curriculum is unique and is in fact a privilege for which we're very grateful. So we'd like to thank our dean, our colleagues, and our dedicated team of staff for their ongoing support in allowing our students to teach alongside us in the curriculum. We also want to thank our students because without them and without their enthusiasm for education and their dedication to teaching their own peers, we would not be here today to accept this award. Finally, we'd like to thank our families as well to support the work that we have with our students and being there alongside with us. So we're very thankful to receive this award. Thank you again.
Next up, I'd like to present Lauren Junckman from the School of Pharmacy. She's being recognized for integrating social justice and health equity into the population health and management core course in the PharmD curriculum.
We live in a world that's inequitable, something that's become increasingly evident to many more people during the past year. Health profession students have a duty to respond to health inequities that stem from underlying factors in our system and society and result in premature death and disease for so many. Over the last several years, I've been working to be more intentional in my teaching to focus to infuse a focus on health equity and social justice into all aspects of the population health course in hopes of achieving these goals beyond the classroom for students. I was incredibly lucky to have wonderful students in the 4th professional year, Hajar Mohammedine and Tai Nguyen, who worked with me over the summer to transition the course for a virtual setting using a general flipped classroom approach with team-based learning. And this transition has created additional opportunities to be more explicit in our work, allowing for in-depth discussion and participation in complex areas of health equity, including racism in medicine. Further, the restructure allowed for more focused emphasis on the social determinants of health through poverty simulation and other practical activities, and insights into the needs of people through an inclusion medicine practicum with standardized patients addressing issues around health beliefs, cross-cultural negotiation, and healthcare for marginalized populations.
Next up, I'd like to introduce Andrew McCormick and Dara Mendez from the Schools of Medicine and Public Health.
Often in academic medicine, we sit in silos. We kind of sit in one area and we're not able to kind of work out of our own experience. But really one of the lessons we learned was collaboration. Collaboration started in my home. So I wanted to first thank my wife, Rena McCormick, who is the true visionary in our family, challenger, and also connector, because this started with discussions at home, but she was the connector that connected me to Dr. Mendez. And also what we would really like to highlight is the importance of our community partners. As we partnered with Healthy Start Pittsburgh, with Ms. Jada Sherrill and Ms. Demia Horsley, who really helped bring this outside of the academic world and into the community where work is done. So collaboration was a key to our experience.
And the impetus of the work that Andrew mentioned began in 2019. And really our goal was to try and shift the curriculum, shift the culture in medicine and health to help address medical racism, and that this work is not one course and one done, or one book and one done, that it's work across the career, it's across the lifetime, and has features throughout.
And I would like to say that, you know, one of the things that we really wanted to center after learning this experience was the voices of our medical students. And one of the voices they said was that this was foundational knowledge. Just like they go to anatomy and physiology and biochemistry, that understanding about racism and racism in medicine and discrimination in medicine is a key factor for how they can offer true health by recognizing and being anti-racist, by being anti-discrimination.
Right, and finally, not only the knowledge that is provided, but the tools that are really critical and important in shifting this work that we do, you know, as practitioners in medicine and practitioners in public health, and extending to other health fields. That continuous self-reflection is critical. A key element of critical race theory and public health critical race praxis. And that specific actions are also warranted and really key and critical. So taking what they're learning in the classroom and then applying it in those settings, which is even more important and prevalent with our global pandemic, right? And the intersection with the movement for Black lives and addressing racism across a number of sectors.
Wonderful, congratulations again. And please join me in congratulating the 2020 Diversity in the Curriculum Award winners.